So for our CAT project, we did mirror therapy and how it affects phantom limb pain. So phantom limb pain affects a lot of the amputee population. There's a lot of options for treatment, but very few are effective. So for the last couple decades, they've been trying to come up with better options for them. And mirror therapy is one of them because it creates such a disability. Our clinical question was, what is the effect of mirror therapy on pain in patients with phantom limb pain compared to no treatment? For our PICO, we had patient and client group were amputees with phantom limb pain. The intervention was mirror therapy compared to no mirror therapy, and then our outcome was reduction in pain using those scales. And the sources we used for our evidence are listed there.
Our inclusion and exclusion criteria is listed here. The inclusion criteria aligns with our PICO question and also includes evidence that is level 2B or higher. We excluded studies that used a teletreatment or that were expert reports. Our search returned 5 studies that answered our clinical question. 3 of those studies met the inclusion criteria. Of the 3 studies, 2 were randomized control trials and 1 was a cohort study. All 3 studies reported that mirror therapy had a significant effect on phantom limb pain. This is our first study. They had 60 participants, all of which were males. It was a randomized single crossover design with the test group receiving 4 weeks of mirror therapy and then the control group receiving 4 weeks of covered mirror therapy before crossing over and receiving mirror therapy. They measured pain using the VAS, and they measured that at baseline and every 4 weeks after treatment. They found a significant reduction in both groups after receiving the treatment, which is noted by the p-value being less than 0.05. However, with this study, they did not show an effect size. And so that impacted the validity score that you see below, which is 24. It is a pretty high score, but they didn't have the effect size and they didn't tell us where the protocol could be found.
The second study we used was a randomized control trial as well. It had 15 participants that were all male. And you can see that they had listed their inclusion and exclusion criteria. There were 3 groups, the treatment group being mirror therapy, and then 2 control groups, one being covered mirror therapy and one being mental visualization. They use the visual analytic scale taken at baseline and then beginning at each session for 4 weeks, 5 days a week. As you can see, there was a significant decrease in the treatment group, with the p-value being 0.001. In the effect size, you can also see there, the Cohen's d was 0.971, showing that there was significant decrease considering the effect size. As you can see, the validity score was very high. They did clearly outline eligibility. They did random allocation, limitations, and those sorts of things, but you could not find who had mentioned, like, who was blinded during the study and who enrolled them, or changes, if there were any. They didn't really explain what they would have done. At the end, they concluded that mirror therapy significantly reduced PLP and amputees after 4 weeks of treatment, 5 days a week.
For our last study, there was 24 participants, but 9 ended up being dropped, and they were mostly males. It was a cohort design. They measured pain using the numerical pain intensity scale and measured before and after every treatment, which was different from the other articles. They had significant decrease in average phantom limb pain scores every week for the 4 weeks. And this was shown by the p-value being less than 0.01. The validity score we scored was a 20, which is, we used the Strobe checklist because it had a good background rationale, discussed settings, important dates. explained why the participants dropped or why they didn't use their information, but it also didn't explain some things like how they selected their sample. And it concluded that mirror therapy helps manage and decrease phantom limb pain.
Overall, the strengths of the studies, they had evidence of 2B or higher. They showed positive impact on phantom limb pain, and the one study was the largest and longest known study on this topic at the time. The limitations, however, we had studies that had very small sample sizes, which could affect the power of the studies. Their samples comprised mostly of males. Total, there were only 2 females participated throughout the 3 studies. And individuals mostly were currently or previously serving in the military. The one study was done remote, however, there were no adverse effects stated at the end of the study. And the participants who were included in that study had to demonstrate that they knew the interventions in person before they were sent home to do this intervention at home. Future research, we had discussed more female participants and citizen participants, larger sample sizes to control the power of the studies, and longer follow-up periods just to determine if the symptoms can be managed long-term after they are done with the study. And our clinical bottom line is that there was matter of evidence to suggest that mirror therapy decreases phantom limb pain in male amputees. And these are our references.